Prior to taking a dental impression, sufficient retraction and hemostasis of the soft tissue is essential. Blood and crevicular fluid restrict flow of impression material into the sulcus, often resulting in voids and loss of detail. Fluids can hinder the setting of the impression material, causing flaws that reduce the accuracy of the final impression. Impression flaws lead to retakes and ill-fitting restorations, increasing chair time and lowering productivity and predictability. Now, quality impressions can be consistently achieved with new premier Traxodent Hemodent paste retraction system. Traxodent is a retraction and hemostatic system for use prior to impression making, cementation, bonding procedures, or wherever hemostasis and retraction are required. Traxodent paste contains 15% aluminum chloride, a proven effective hemostatic agent. The absorbent paste displaces soft tissue and works synergistically with the astringent properties of aluminum chloride to create retraction. Fluid is absorbed while Traxodent occupies the sulcus. After 2 minutes, Traxodent is rinsed away, leaving an open, retracted sulcus. Traxodent offers significant benefits: predictable results, superior hemostasis and retraction, reduced retakes, less chair time, minimized tissue trauma, and a dramatic increase in patient comfort. Packaged in resealable foil pouches, Traxodent paste is conveniently preloaded in disposable syringes. The slim design of the syringe and adaptable tip allow for easy access into all areas of the mouth. The Traxodent system is sold with preloaded syringes and applicator tips and can be ready in seconds for fast, effective retraction and hemostasis. There are no cumbersome guns, and it eliminates the need for hemostatic solutions. Individual foil bags keep the material fresh and allow for convenient storage. Traxodent is easy to use. To begin, remove the cap from the syringe and retain it for subsequent storage of the material. Place the dispensing cannula onto the syringe and twist lock it into place. The dispensing tip can be easily bent for optimal access. A mirror handle can assist in bending the tip to the desired angle. Rinse and air dry the prepared tooth. Extrude Traxodent slowly into the sulcus while keeping the dispensing tip just above the sulcus and aligned approximately parallel to the axial plane of the tooth preparation. Be careful not to jam the dispensing tip into the sulcus. Sufficient material must be extruded into the sulcus to achieve adequate tissue retraction. Allow Traxodent paste to remain in the sulcus for at least 2 minutes or until adequate retraction and hemostasis has been achieved. After hemostasis has been achieved, the Traxodent should be removed by thoroughly rinsing using an air-water syringe and suction. Examine the treatment site to verify complete removal of the Traxodent prior to taking the impression. It is recommended to use a premier retraction cap for deep subgingival margins and thick tissue and to ensure that Traxodent reaches the base of the sulcus and maximum tissue retraction is achieved. Optionally, a single strand of cord can be placed prior to dispensing Traxodent. Traxodent can replace the second cord in the double cord retraction technique. The cord can stay in the sulcus until the final cementation of the provisional. Removing the cord after the cementation will lift away biological debris and cement flash that may have accumulated. Let's address some frequently asked questions concerning Traxodent. Can Traxodent be used in a bloody site? Yes. Stasis and absorption are the hallmark characteristics of this material. What is in Traxodent? 15% aluminum chloride infused in a clay matrix. Will Traxodent displace tissue? Yes, especially when premier retraction caps are used to move Traxodent into the sulcus. Do I need to use cord for subgingival preps? Either a retraction cap after Traxodent placement or small diameter cord prior to placement are excellent options to enhance retraction. How many applications per syringe? Each syringe is good for 3 to 6 units. Does Traxodent require special needle tips? No. Common 18-gauge bendable needles with Luer lock male fittings are supplied with the material. The Traxodent hemostatic paste retraction system provides predictable tissue management for accurate, detailed impressions necessary to achieve aesthetic restorations. Impression retakes are reduced or eliminated. The sealed foil pouches keep the material fresh until needed, and the system can be ready in seconds. Available in a 7-syringe starter pack and economical 25-syringe value pack, Traxodent is sold complete with everything you need for a successful retraction procedure. There are no hidden costs or ancillary products to keep track of. Choose Traxodent Hemodent Retraction Paste for your next impression procedure, an innovative tissue management system for fast and predictable results.